Hi, and welcome to the Life After 50 show. I'm Katherine Watson, and I'll be your host today as we delve into the world of Medicare. I have two experts on today with me to talk about Medicare. This show is sponsored today by Find Houston Senior Care. Find Houston Senior Care is a web directory offering options and solutions for anybody looking for elder care in the greater Houston area. The website is chock full of home care, home health, hospice, elder care law, assisted living, independent living, and so many more resources. We have over 500 articles, podcasts, and videos to help you understand and navigate this elder care world. Today on the Life After 50 show, I want to bring in two guests, and I'm hoping it'll be two. One of them is having a little technical difficulty, so hopefully Nicole Tussey will be able to join us later. Right now, I'm going to bring in Jamie Spratley. She is an independent Medicare advisor. What that means is she is able to help you with whatever Medicare solution is best for you. So she doesn't work with just one company. She works with a multitude of companies, and she can take care of traditional Medicare and Medicare Advantage plans, lots of different options. And we're going to be talking about what some of those things are. Some of these terms may be foreign to you. So whether you are looking for Medicare for yourself, or maybe you're younger but have an aging parent that needs help with Medicare, you want to listen to this show today. Ask your questions in the comments below, and we'll be glad to answer them. If you're watching the replay, it's okay. Go ahead and ask your questions too. We'll be able to bring Nicole or Jamie in to answer those questions for you. All right, we're going to go ahead and get started, and I'm going to bring Jamie on up. Hi, Jamie. How are you?
I'm wonderful. How are you doing this morning?
Good, good. I'm so glad to have you on the program.
Thank you.
Your information is really valuable. So many people are so confused about Medicare and what they need to know about it and how to get started with it. So let's just kind of start with the basics. If somebody is brand new to Medicare, they're maybe getting ready to go on it. The timing is right. Talk to us about what they need to know.
Yes. Well, and something that we'll probably cover through this conversation as well is understanding their Medicare out-of-pocket cost and responsibility, and understanding their supplemental options, because there are a couple of ways to go through private insurance carriers to assist you in covering the out-of-pocket costs that Medicare does not cover whenever you have Medicare Parts A and B. So there's a lot of different factors that comes into choosing a type of plan as well. Your doctors, is there a network, what insurance plans they take. So understanding how the networks and the cost coverage with your supplement, for me, is probably the most important to understand.
Okay. All right. So if I am getting ready to turn 65 and say I am planning to still work, do I need to be on Medicare? Do I need to sign up for it?
If you are a Medicare beneficiary age and you turn 65, you are automatically enrolled into Medicare Part A. And so that'll be there whether you have employer coverage or even if you are going to be retiring. Now, if you're going to keep your group insurance as far as your employer coverage, the Human Resources Department will let you know, or you can inquire and ask them if they are wanting you to apply for Medicare Part B to be paired with your group insurance. There are certain carriers or companies, that do not require this. So therefore, we wouldn't want you to spend money on the Part B premium if it's not needed. However, if the group insurance that you have does want you to have Medicare Part B in order to help in the cost share and the pay,
Mhm.
then you will actually do the application and take it down to your Social Security department.
Okay. All right. So let's back up a little bit. A, B, it all gets quite confusing, Jamie. Tell us what is Part A and what is Part B and any other letters I need to know about, okay?
Exactly. There's quite a bit. So original Medicare consists of two parts. You have Part A, and this is your hospital. So whenever you go on Medicare, your Part A, you generally do not have a monthly premium for. And this is because you've paid into your Medicare payroll taxes, an equivalency of 10 years. Once you've reached that and you go on Medicare, your Part A does not have an actual monthly premium. However, if you go into the hospital, you do have a hospital deductible of $1,340. So that's just for going into the hospital.
Okay.
If you're in the hospital beyond 60 days, then there are a per day copay that you have beyond that point. Whenever you have, you have your Part A, and then you have the second part to original Medicare, which is Part B. Part B, you do have a monthly premium. As of right now, the standardized American rate is at $134, and it is generally withdrawn from your Social Security check. If you're not drawing Social Security, then they'll bill you for your Medicare Part B. So your Medicare Part B is everything else. It's your medical. It's your lab, your x-rays, your doctor visits, any procedures. Everything else will fall under Medicare Part B. So you do have the Part B premium, but whenever you utilize it, then your actual out-of-pocket cost is 20% of the Medicare contracted rate.
Okay.
So bird's eye view, you have your Part A hospital deductible and your Part B 20%. Okay. So with these out-of-pocket costs, that's where your supplemental options come in. You literally have two ways to cover your out-of-pocket cost that original Medicare does not cover. And one is your Medicare supplement, or what is also known as a Medigap policy. And then over here, you have a Medicare Advantage. They just work different, but they both cover the out-of-pocket cost that original Medicare does not cover.
Okay. All right. So, I think that's an eye opener for a lot of people. A lot of people have assumed that once they got on Medicare, it paid for everything, and it doesn't. So it's important to know that and to plan accordingly as you're, getting into your retirement years. So
Right.
that's really important. So let's talk about some of these different options, Medigap and Medicare Advantage. I know we hear those terms a lot, and it can be quite confusing. So tell us a little bit about what's the difference between those two and why would I choose one over the other?
Well, as an insurance broker, whenever I first meet a Medicare beneficiary, the first thing I do is a needs assessment. And rather, you reach out to me or you have somebody else somewhere in a different state, it's always good to reach out to an agent and ask them to assist you with what's called a needs assessment. This is where they will look at your doctors and your medications and be able to assist you in narrowing down the options that are going to be best to fit your needs, in keeping your medications in the formulary, as well as doctors that are important to you, allowing you to have access to still see them. Because the two options, your two options of covering the out-of-pocket with your supplemental coverages, they both work very different. So the Medicare supplement, also known as the Medigap, is where you pay a monthly premium every month. It's based on your age and your zip code. It does have an annual increase. And pay this monthly premium, it can be anywhere from, there's several different types, but it could be $100, $180, depending on the type of supplement. But the main reason why a person would choose that option is because they can go to any doctor in the country that's contracted with Medicare. So there's no network. They have actual access to any physician that's contracted with Medicare. So they don't have to worry about in or out of network. So you have that is a Medigap policy.
Mm-hmm.
The second option is going to be what is a Medicare Advantage. And this is where the HMO and the PPO is. So a Medicare Advantage, it's going to, of course, cover the Part A hospital and the Part B 20%. And then it generally will always have, for the most part, will have your prescription drug built into it. So it's all rolled into one. Whenever you have a Medicare Advantage plan, the in and out of network, the PPO and the HMO is going to be determining on what your doctor accepts insurance wise. So that's where that needs assessment comes in to see what your doctors accept. HMOs will generally be $0 a month. You do have just in network, you have a network of providers that you stay within. You'll have additional benefits above and beyond original Medicare, like vision, dental, hearing. So those are a lot of nice additional benefits that come with the Medicare Advantage. And these are all through private insurance carriers. So all the different companies that you're being inundated with right now in the mailbox, those are the companies that are going to have the Medicare Advantage plans. And then you have a PPO. A PPO is where you're going to have in and out of network. The out of network is going to have a higher cost sharing, generally a percentage, but it gives you flexibility. So it gives you, it's kind of the middle ground where you don't have just a closed network or a smaller network, and it's not a monthly premium like a Medigap policy. So it kind of falls in line in the center.
Okay. So let me ask you something, and then we've got a few questions that people are asking, and I'll get to those. So hang in there, Ashley and Kim. We'll get your questions answered too. But I wanted to ask you, what if somebody, say they travel a lot? Maybe they have bought an RV and they're going to go on the road. So they may spend some time here, some time living somewhere else. Maybe they're going to spend the summers in Colorado where it's nice and cool. And then they're going to come here for the winters to get away from the cold. So how would an Advantage plan work for them, or is that something I'm not sure? Would the PPO part work for them?
My recommendation, as far as if there's going to be a lot of traveling, would be likely the Medigap policy.
Okay.
They do have, right, for traveling.
That's traditional or original Medicare, and the supplemental insurance policy to go with it, the Medigap, correct?
Yes, correct.
Yes. Okay.
So there are various types of Medigap policies. They even have low premium and high deductible. So there are, you don't always have to go with an expensive one. There are middle grounds, but the most important part of having a Medigap policy is going to be the fact that you have the flexibility to see physicians anywhere that's contracted with Medicare. Now, if you're on a Medicare Advantage plan, like an HMO or PPO, and you're traveling, you have emergency benefits. So no matter what, you have access to hospitals, urgent care, any medically necessary treatments that you need are always going to be covered at your in-network copay. So traveling for brief amounts of time, even for a couple of months, then your Medicare Advantage plan will be just fine. My personal opinion as an agent, and what I would tell somebody if they were going to be staying somewhere for 3 months or 6 months, if they're going to be anywhere where they think they might want to go see a physician for a physical, or if they're going to be somewhere long enough and maybe they had a cardiologist back at home and they're going to need follow-ups with a cardiologist where they're living or where they're staying for that 3 to 6 months, for example, then I would recommend the Medigap policy, which is the supplement that will give you access to any doctor that's contracted with Medicare.
Okay.
So basically, if you're staying somewhere for a long period of time, it would be good to get some quotes for Medigap policies. If you're just doing brief traveling and your emergency benefits are pretty much all you're looking to have, then your Medicare Advantage plan will take care of that for you.
Okay, good to know. Let's see, we've got a few questions here. Let me put one up on the screen. We've got Ashley. Ashley wants to know, what options are there if the prescription drug cost is high? And let's face it, Ashley, they're all high, aren't they?
That's a very good question.
Yeah.
There are a couple of different ways. Let's see, if your prescription drugs are high, asking your doctor for samples. A lot of doctors are able to provide for you samples, which really help, especially if the prescription drug is a brand name, because those are higher cost and they do cost more out of your pocket because of the expense of it. That's one way. A second way is to ask your physician if there is a generic alternative. So if you're on an expensive brand name, then there may be an alternative that you can try that would be more cost effective for your pocketbook. And then let's see, another thing I would recommend as well looking into is there is federal assistance for assisting you with your prescription drug costs. And what this is extra help with prescription drug through Medicare. And so whenever you do the application, it is based on a certain income amount, as well as a few other qualifying questions that they'll have for you. For example, do you have a second property, or because it's going to be assistance for more limited restricted Medicare beneficiaries. So if you do that application and you're able to get approved, then that will bring the cost of the medications down drastically. It's a form of Medicaid, basically.
Right. Okay. I know there's another option too. A lot of times the drug companies will have their own internal programs. And Nicole, we have lost your audio. I'm not hearing you at all. So please check your audio. Can you speak? Say something so I know if it's working. Okay. Nicole's not speaking, so I'm not sure if she's hearing me. It looks like she's not. Refresh your screen, Nicole. Okay, Nicole, you're going to have to refresh the screen, please. She's not hearing me. Okay. So I'm not sure what is going on. We're having some technical difficulties today. Unfortunately, I'm not sure what's happening. Let me see if I can get her back on the line. If everybody will just hang in with me. Ashley, we're going to get your questions completely answered. Okay. Okay, Nicole, can you hear me now? Okay, Nicole's still not hearing me. Nicole, please speak. If I can just get her to talk. I think we could hear Nicole if she would speak, but she's not speaking. Okay. Unfortunately, the Life After 50 show is going to have to end quickly today. We're having some technical difficulties. I'm not sure what happened with Jamie, but we'll see if we can get them back on. Nicole was not able to join us. We'll see if we can get them to come back on later. I will make sure that they go in and answer some of your questions, okay? All right. We will talk to you later. This is the Life After 50 show, and I am Catherine Watson. We try to bring you good information every week, and I would love to have Jamie and Nicole come back on soon, maybe even today if we can get the technology working.